Knock, knock.
Come in.
Hand hygiene, pump, pump.
Hi, my name's Kaylee. I'm your student nurse today. How are you? Good. How are you?
Good. So I'm just here to do a routine head-to-toe assessment. Is that okay with you?
Yeah.
All right. Can you tell me your full name and date of birth?
Madison Koberg, May 13th, 2003.
Awesome. I'm comparing that to the bracelet. Madison, do you have any allergies?
No.
All right. And can you tell me where you are?
In the hospital.
All right. Perfect. So that tells me you're oriented to time, place, in person. So I'm going to go ahead and just start by elevating the head of the bed. All right, perfect. I'm going to just ask you a quick question. I'm going to ask you 3 words, and you're just going to have to remember them for later, okay?
Okay.
Dog, cup, tree.
Dog, cup, tree.
Perfect. So just remember those for later.
Okay.
So I'm going to start off by palpating the head, checking to see if there's any sort of abrasions or deformities. And I don't see any, so I'm just going to go ahead and have you tuck your hair behind your ears. Perfect. I'm going to start off by checking the ears. I'm going to palpate this side. Any pain or tenderness?
No.
Perfect. I'm going to pull the ear up and back, look inside. Same with the other side. Perfect. So I'm going to just stand to the side here so you can't see me. Keep looking straight forward. I'm going to whisper a word to you, and you tell me what I'm whispering, okay?
Okay. Pillow.
And the other side.
Lamp.
Perfect. Alright, so now I'm just going to move right onto your eyes. I'm going to start with the light, checking for parallel on both sides. Alert pupils. Perfect. They're equal and reactive to light. I'm going to move on to the H formation. So can you just go ahead and follow my finger? Testing the ocular motor nerve. Perfect. All right. So I'm just going to go ahead and look. Actually, I'm going to have you do this first. Go ahead and cover one eye. So I'm going to go over to that side. And I'm testing your peripheral vision. So you tell me when you see my finger.
See it.
Perfect. And the other side, go ahead and cover your other eye.
Now.
So now I'm going to come from the top
Now.
and the bottom.
Now.
Great. I'm going to go ahead and check in your nose, look for any abrasions, any lesions. Don't see any. Open your mouth, say ah.
Ah.
Good. And I see equal movement on both sides. All right. Have you been feeling any sort of pain around your face?
Nope.
All right, I'm going to go ahead and palpate for swelling. You go ahead and tell me if you feel any pain. Any pain? No? All right, I'm checking under. Good. Checking your thyroid. Going down, palpating all of your lymph nodes. I don't feel any enlargement. Any pain? Nope. Perfect. I'm just going to move your hair back here. Checking for vein distension here. I don't see any. So I'm going to go ahead and palpate the trachea, making sure it's straight. Can you go ahead and swallow for me? Perfect. All right, so we're just going to do some range of motion exercises with your neck. You don't have any neck pain?
Nope.
All right, can you put your head forward, head back, side, and side? Any pain with that? Nope. Awesome. So I'm just going to have you put your hands down to your sides, and I'm going to listen to your lung sounds and your heart sounds. For a normal assessment, I would go under your clothes, but for the purpose of this video, I'm going to go over them. Right. I'm going to start off with your heart sounds. Starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and now I'm going to do lung sounds. Breathe in, breathe out, breathe in, breathe out. Same thing. Perfect. And while I'm up front here, I'm just going to go ahead and auscultate the carotid. It's a heart sound, so you don't need to do it. But thank you. Thank you for your participation. All right, so I'm just going to have you lean back, head the big go down. All right, so now I'm going to also take the vowel sounds. Vowel sounds are normal, active. And I'm gonna palpate. When was the last time you went to the bathroom?
An hour ago.
Alright, and any pain?
No.
Perfect. Abdomen is soft, non-distended, and non-tender. Alright, so I'm gonna go ahead and sit you right back up. And now we're going to test, we're going to also take your posterior lung sounds. Breathe in. In. Perfect. Normal lung sounds. So I'm going to have you turn to the side for me because this is an awful angle on a broken futon. And I'm just going to go ahead and feel at your spine. You tell me if there's any pain here. Any pain?
No pain.
All right, and the spine feels straight. I'm going to go ahead and have you breathe in and breathe out. Normal expansion on both sides. You can go ahead and lean right back. Thank you. Now I'm going to go ahead and take a look at your arms here. I don't know any swelling, skin, warm, pink, dry, intact. Do you have any pain in your upper arms?
Nope.
Any pain in any part of your arm?
Nope.
All right, so we're just going to do some quick range of motion exercises on the arms. Can you bend up for me? Perfect, and back down. Can you roll your wrists? Great. And I'm just going to test your strength. Can you go ahead and squeeze? All right, equal strength on both sides. That's perfect. I'm going to go ahead and move down to the legs. Looking and assessing for any edema. You do not see any edema. Skin is also warm, pink, dry, and intact. I'm going to go ahead and feel your pedal pulses. Bilateral +2 pulses on both feet. I'm going to have you do some range of motion exercises. You just go ahead and straighten out your leg. Perfect. We're going to bring this leg over a little bit so you don't hit your toe. All right, and up. Up. Perfect. You go ahead and push up on my hands. Great. Push down on my hands. Good. So I'm just going to go ahead and test some coordination here. You're going to put your first finger to your thumb, second, third, fourth, and 4, 3, 2, 1. Perfect. So I'm going to go ahead and set up the head of the bed. Can you go ahead and stand for me if that's comfortable for you? All right, so now I'm just going to have you stand right here and walk heel to toe all the way to me. Perfect. And turn around and head right back.
Heel to toe?
Heel to toe.
Oh, okay.
Great. So now you can go ahead and face me. We're just going to test your balance real quick. Can you put your feet together, hands to your side, and close your eyes? Perfect. All right, you can go ahead and have a seat. Okay, you can lay right back down if you want to. Find a comfortable position. Is there anything else that you need from me?
Nope. I think I'm good.
All right, I'm going to just go ahead and ask you for those 3 words I told you at the beginning.
Dog, cup, tree.
Perfect. So that short-term memory is doing great. If you don't need anything else from me, I'm going to put the call bell next to you, put the bed in the lowest position, and you ring that if you need anything else.
Okay.
Great. Thank you, Madison.